Hello, everyone, and welcome to today's podcast. Today, we will be discussing common symptoms and early warning signs of vertigo, a condition that affects millions of people and can significantly impact daily life if not recognized and managed early. We are delighted to have Dr. Gaurav Batni, an ENT specialist from ENT Clinic, Bhopal, with us today to share his expert insights on this important topic. Doctor, thank you for joining us today. To begin with, why is it important to look beyond the inner ear when evaluating dizziness and vertigo?
Glad to be here. This is really important topic because many patients don't improve unless we look beyond just the inner ear.
So, second question is many people confuse anxiety and vertigo. Can anxiety actually cause symptoms that feel like dizziness or vertigo?
Actually, it can go both ways. Anxiety can cause physical symptoms like lightheadedness, breathlessness, or feeling unsteady. These can be very similar to vertigo. At the same time, people with vestibular disorders often develop anxiety because the symptoms are unpredictable and distressing. In conditions like persistent perpetual dizziness, the brain becomes overly sensitive to movement and surroundings, and people may start avoiding activities. Exactly. The symptoms are real, and both the physical and emotional aspects need treatment together.
Nicely explained, doctor. So, moving ahead, can long term dizziness also impact a person's emotional well being or mental health?
Yes, quite commonly, people with chronic dizziness may reduce their daily activities, stop going out, or lose confidence. That can lead to low moods. But it's not just emotional studies that show higher rates of depression in people with vestibular disorders overall. And when depression sets in, patients may find it harder to stick to rehabilitation or stay active, which slowly recovers.
So, moving further, is every form of dizziness actually vertigo, or could there be other causes?
Not all dizziness is vertigo. For example, orthostatic hypotension, a drop in blood pressure when standing, can cause lightheadedness, blurred vision, or even fainting. This feels very different from spinning vertigo. But patients often use the same word, dizzy.
That's helpful to understand. So, doctor, can you explain about can medications or changes in blood pressure also contribute to dizziness?
Definitely, some blood pressure medicines or sedatives can worsen balance or cause dizziness, especially in older adults. So, if symptoms happen when standing up or with medication changes, we need to look beyond the ear.
That's interesting. We also hear about migraine related dizziness. Could you explain what vestibular migraine is?
There is a condition called vestibular migraine when people have dizziness or vertigo along with migraine, features like headache, light sensitivity, or nausea. Some people don't even realize they have migraine. They just say, I feel dizzy. If we miss this diagnosis, we miss an important opportunity for prevention and treatment.
Lastly, how does diabetes affect balance and dizziness?
Diabetes affects balance in a few ways. First, diabetic neuropathy can cause damage to nerves in the feet, causing reduced sensation. This makes it harder for the brain to maintain balance, hence, increased risk of fall. Second, there is some evidence that inner ear function may also be affected in diabetes. And finally, low blood sugar can cause dizziness, confusion, and weakness. which can sometimes be mistaken for vertigo. Exactly, the body doesn't work in silo, and neither should treatment.
Thank you, doctor, for your valuable advice and guidance for patients. A public awareness initiative by Dr. Reddy's. This communication does not substitute advice of a medical practitioner. Please consult your doctor for any medical advice.